WAJR's Ask the Experts continues. We welcome you back in. Tony Caridi in studio with the folks from HealthWorks Rehab and Fitness, joined by Dr. Nguyen, who is the chair of the Division of Athletic Training at WVU, Bob Cable, Senior Associate Director of Athletics for Sports Medicine, Game Day Coverage at Fairmont State, and Tim Turner, who is the Clinical Director of HealthWorks location in Fairmont. We mentioned in our opening segment how the curriculum at WVU and across the nation has changed in this world. Guys, if we could, let's talk about a bigger topic. If someone's listening in and they have interest in this field, some type of a marriage between medicine and athletics, maybe that could be one way you could go. But there are so many trickle-down effects that one can go in different directions. Let's kind of throw those out there. I mean, I've got a doctor, I've got a physical therapist, I've got people with master's degrees. You guys all went same world, taking different roads. What are the opportunities for someone as they enter into this field?
Well, I think especially with the new curriculum, having the master's level of athletic training definitely opens up opportunities, and they can stay within the athletic training curriculum as a professional and workforce, or they can go on to other education opportunities that may include more master's degrees, doctorate level programs. For instance, for me, I went to a doctorate of physical therapy program, and once I completed that and had adequate experience in the field of sports medicine, I actually obtained a credential in sports specialty for physical therapy. So there's a lot of different routes that you can go, both academic, clinical, or even educational.
Bob, you have seen this. You've seen this change unbelievably, huh?
I mean, Tim is right on, and I think that's the whole purpose in what the NATA and the BOC are doing. This is the medical model. You start out going to undergraduate school, and then when you've finished all your undergraduate curriculum, you then go on to medical school. The doctors go on to medical school. We'll go on to get our master's in athletic training. When it's over, there are other things that the doctors have to do. If you want to be a pediatric doctor or an orthopedic, you've got to go do that. And I think that's what the NATA and the BOC are trying to ultimately do, so that there is specializations involved with each of those.
Doctor, what about you? Did when you were a young guy growing up, where was your aspiration? How'd you get to where you are?
Yeah, I think we all get into it because we love the clinical part. It's working with athletes, getting them back, like you said, getting back to a high level of performance. And then I think your personal and professional goals might change, but you want to stay in the field. So an area that I pursued and that we're actually developing here at WVU is maybe providing a research component. My research area is really looking at the biomechanics of ACL injuries. It's a huge topic that we know that is directly affected with the youth athletes. And so an area that many athletic trainers might not pursue is maybe an area of research, like you said, combining that ability to continue to evolve and learn new techniques is an area that I was very interested in.
Let's take it one step further, because the treatment methods are constantly changing. I mean, right? It never stays the same. Bob, I would imagine back in the day, it was a bag of ice and 20 minutes on and 20 minutes off. And now, guys, we're seeing devices that have been built, right? Game-ready device, which uses water and cold and air, and we're seeing all different kinds of things. I would imagine that's what keeps you guys totally intrigued by the world that you're living in, because there's always a different way, right? Always a better mousetrap to figure out how to make things go better.
Yeah, absolutely. And our profession now is like other medical professions. It's all evidence-based. So they're doing a lot of research. As Yum said, that research is a huge thing to make sure that what we're doing is the appropriate thing to do to make the healing, help the healing process and get that athlete back to performing at a maximum level as quickly as we can.
As you guys look at the world you're in today to where it was when you first started, so these are different times that you guys all entered into this world. What makes you shake your head at the wow. Have you had a wow moment as to how your world has changed from what was to what is?
Yeah, I think the biggest thing is being able to incorporate many different facets of medicine into an athlete's care. And so that may be not only the physical component of the rehab, but there's the sports psychology behind it, there's the nutrition component, there's the strength and conditioning component. And we as the sports medicine team have to be cognizant of that in order to maximize the output the athletes need to get back to play.
Bob, something for you that makes you go, wow?
Just all the research that's being done. I mean, it is either doing one of two things. It's proving what we've been done is wrong and we're going the right direction, or it's confirming what we're doing. And I mean, I spend more time every year reading research and just seeing where we're headed, because evidence-based is the ticket now with everything we do.
Yeah. And doctor, you said the nasty 3-letter word, ACL, which is, it just permeates the world of sports, right? At every level, at every level. And I find it quite interesting that you guys are specifically researching that here, obviously to try to make that injury, which used to be, right? It probably used to be a year. I mean, for the most part, back way in the day, to have great development in that, to try to speed that thing up.
Yeah, and our group has been doing this research for probably about 15 years now, and we still don't have an answer. But there are things that we do know is that, yes, we can lower the risk by doing some type of prevention program. The thing we're trying to figure out now is, are there tailored programs that we need? Because obviously not everyone's the same.
Sure.
And so we're really doing a lot of biomechanical work, a lot of screening, and that's the hopes, is to bring it to this community. Previously, with my research group, we do a lot with a lot of soccer clubs. And that's what we're hoping to do, is provide a service for the community here in Morgantown and across the state, but really trying to work with these organizations to just try to reduce some of these major injuries.
Yeah, absolutely. All right, we invite you to stay tuned. More to talk about. HealthWorks for You, sponsored by the folks from HealthWorks Rehab and Fitness. We'll be back with our final segment coming up here on WAJR.